Growing up, Amy went to college, was on the dean's list, played volleyball, and was captain of the debate team. She was outgoing and enjoyed life. All of that changed when she met Brian through an online dating app and relocated to rural Steele County to live with him. Early in their relationship, Amy loved the attention and gifts that Brian gave her. However, that slowly changed as Amy started working. Brian didn't like that she was becoming friends with her coworkers. He went through her phone and monitored her social media accounts. He repeatedly called her throughout the day and showed up unannounced at her place of employment. Her coworkers and supervisor grew afraid as his behavior became increasingly erratic. At home, she endured constant verbal abuse. She was frequently assaulted physically and sexually. Brian often punched her in the stomach, ribs, and back, careful not to leave visible bruises. He made Amy pay all of the bills, and she was broke, especially after she lost her job. Over time, Brian alienated Amy from her parents and friends. She felt alone and unable to tell anyone about the abuse. One night, Amy was screamed at, hit, sexually assaulted, and thrown down a flight of stairs. She feared for her life, but was scared to call 911, as Brian was a well-known member of the community. Crying hysterically, Amy reached out to the Crisis Resource Center of Steele County, saying, "I'm going to end up dead if you don't help me." Unfortunately, Amy's story is not unique. In Minnesota, about 27% of women and 8% of men report experiencing intimate partner violence in their lifetimes. Rates are even higher in rural areas, such as Steele County. Violence does not discriminate and affects all ages, genders, races, religions, sexual orientations, and socioeconomic classes. Anyone can be a victim: a friend, a neighbor, a coworker, a parent, a sibling, a child. In Steele County, Minnesota, the Crisis Resource Center is working to support women, men, and children experiencing child abuse, domestic violence, and sexual assault. We are the only provider serving the estimated 37,000 residents of Steele County. Every year, we support more than 1,100 county residents. Our goal is to ensure that victims of abuse are safe and do not experience subsequent violence. To reach this goal, we provide a comprehensive array of services and supports for victims of child abuse, domestic violence, and sexual assault. All of our services and supports align with established best practices. Crisis Resource Center staff and trained volunteers provide immediate crisis support whenever it is needed. Our crisis support services are available 24 hours a day, 7 days a week. The crisis line is available whenever victims, like Amy, call for help. Calls to the crisis line can also be made by other professionals on behalf of victims, including hospital staff, law enforcement personnel, and others. Calls to our crisis line, as well as all of our other services, are completely confidential and free of charge. We work closely with victims and our network of community partners to offer a variety of one-time or ongoing supports. The services provided are tailored to meet the individual needs of those we serve. Depending on their specific needs, victims may receive crisis intervention, emotional support, help securing emergency services, including shelter, food, childcare, clothing, and other necessities, accompaniment to medical appointments, law enforcement interviews and court activities, transportation, help filing protection orders, victim reparations claims, or applications for public benefits, access to interpretation, translation, or culturally appropriate materials, and support with immediate safety needs. We also offer age-appropriate and gender-specific ongoing support groups. These support groups are offered for men, women, and children. Support groups are available in a variety of community settings. We take a trauma-informed approach. Our goal is for everyone seeking support to feel safe at all times. We work together closely to develop a plan to ensure physical, emotional, financial, and sexual safety. Our staff and volunteers work with victims in a way that promotes choice, with services driven by clients' needs, strengths, and voices, collaboration between clients, staff, and volunteers, trust between staff and clients, and empowerment as victims receive validation and support as they move towards self-sufficiency. Overall, our services promote community resilience. Our clients not only achieve safety, but also receive coordinated support from other community agencies, including medical, law enforcement, and legal systems. In addition to directly supporting victims of violence and abuse, the Crisis Resource Center works to strengthen these other programs, services, and systems that also respond to the needs of victims. We collaborate with a variety of community partners to ensure an effective, supportive, and coordinated response to victims of abuse. Some of our closest partners include law enforcement, including the Owatonna and Blooming Prairie Police Departments and the Steele County Sheriff's Office, medical services, transitional housing of Steele County, and Southern Minnesota Regional Legal Services. We also work closely with court services, legal representation, corrections and probation, educational agencies, nonprofit social service agencies, spiritual and religious representatives, and others. We partner in a variety of ways, including training, collaborative work groups, information sharing, community provider networks, referral agreements, co-advocacy coordination, and other strategies. We also provide community education and outreach. Presentations are made to a wide array of audiences, including community service groups, civic organizations, professional organizations, and school groups. We rely heavily on a team of trained and supported volunteers. Volunteers support and empower victims of abuse who reach out through our crisis line. They also help with other tasks, such as fundraising and awareness building. Volunteers play a crucial role in strengthening and supporting community resilience by providing essential resources, social connection, and emotional support to victims and survivors of domestic violence. They help create a sense of safety and belonging, which is vital for recovery. By participating in community activities, volunteers contribute to breaking the cycle of domestic violence, promoting long-term healing and safety for survivors. Their efforts not only benefit individuals directly, but also foster a more resilient and supportive community overall. Please contact us if you are interested in volunteering or partnership opportunities.